Is there an increased risk for the patient on its back, and do you do anything for anesthesia to reduce aspiration? Do you plug the area around the ET tube with gauze? Some people do that. Some people will use gauze behind in the caudal oral pharynx. You can certainly do that. It can also get lost in back to the esophagus, so you want to be really careful that that doesn't happen, because what's going to happen is the patient goes home and it comes back up with that bloody gauze the next day. So, or worst case scenario, you could have a foreign body there. So I don't like to do that. What we do is we look at the caudal oral pharynx with 4x magnification with really good light. We make sure we clean out the caudal oral pharynx with gauze, and then we come back with cotton tip applicators to make sure that the trachea is clean and there's nothing behind and above that soft palate. You know, that little soft palatal piece of mucosa that's above the trachea. You could get blood clots, especially if you're doing maxillary work where you're bleeding into the nasal cavity. You can get blood clots back there that cause a lot of problems. So you want to make sure that you milk that soft palate backwards, get that blood clot back into the oral cavity, and that way you can remove it with a couple of cotton tip applicators. And then follow that up with getting down into the trachea with 1 or 2 applicators very carefully and just removing everything down to where you've inflated that endotracheal tube.